Dr. Thompson.
I certainly concur. I mean, when you talk about the dangers of a government payer with no competition, I think Dr. May certainly started off with some classic examples of where government has intervened, and certainly where you had a private sector participant in no way does any better. I can't think of a single industry where the government has intervened, where a private sector industry has been taking place and yet do a better job. In any way, you have a loss of efficiency. Certainly doesn't promote high quality. And I think those are two areas that we don't want to shortchange when we're talking about health care. It's certainly the argument that's made is that that the government will be able to argue and negotiate for lower costs, as Dr. Bessler indicated. Imagine a scenario where the government is the only one that negotiates with the providers. It puts doctors at a disadvantage that you may say, well, in the short run, that's a great way to lower costs. But what's the long run? As Dr. Bessler certainly indicated, that you have fewer bright, intelligent, highly skilled workers going into the healthcare profession. They have an incentive to go elsewhere, and that's not what we want to attract. We want the best and brightest in the healthcare industry, and so when you put the government involved, and especially in a scenario where there's no competition, the long-run effects are you're going to have extreme shortages, and we've seen that in every enterprise where government has intervened, is that there are inefficiencies and shortages in terms of quality of care.
Dr. Sealy.
I'm going to go back to your question on the socialized medicine rationing or denying care. And let me give you the simple but unsophisticated answer is yes. But rationing and denial of care comes in many forms, and in this country. All right? Any American who's dealt with our private insurance system have clearly encountered denials of care, some delays in treatment, waiting on a referral. Care was pre-authorized, but payment denied. Right? Yes, you can go to this. You have to go to this hospital or that doctor because out of network, it's going to cost you more money. Worst of all, the big two: we won't insure you because of a pre-existing condition, or God forbid, we're canceling you because you are sick. That happens in this country. It is not acceptable. It can be fixed. It must be fixed. Now, if you think that employing a public option tomorrow will fix it, you are sadly mistaken. That will not fix it. The simple reality is that in a socially run program where the rights to health care are guaranteed for all, the simple reality is sometimes you run out of other people's money and you can't pay your way. In British Columbia, in Vancouver, the Vancouver health system, I don't know if you guys understand how Canada works. There's provinces in Canada, much like we have states. Each province has its own healthcare system. It's not a nationalized Canadian system. Maybe you didn't know that. So each province has to fund its own care. When they run out of money, and their fiscal year is March to March, from January of 2009 to March of 2009 in Ottawa, they shut down 38 beds in one hospital and 3 ORs for 3 months. If your name was on the list for the last 12 months to get your knee replaced, get back in line, please, and be quiet. There's not an American in this building that would tolerate that. No way. Now, that's draconian rationing. We've got our problems. You heard me say what they were. Admit this. We can fix this. We must fix this. Your votes will do this. It's not rocket science.
Thank you. The fourth question, and we're going to start again with Mrs. Ashmore on this. What are the dangers of our government paying all health care bills with no competition?
Okay, continuing. On Monday at 8 sharp, I had Mother's physicians on the phone in Norman, and he explained nothing in her records would explain this condition. He indicated that even a fast-moving carcinoma could be treated with aggressive radiation to stop growth in 3 days until further protocols could be determined. Her physician graciously called overseas several times during the day, and he began the slow burn I was experiencing with no clinical data to support what we were being told. Meanwhile, I called Blue Cross Blue Shield of Oklahoma, was told no problem with overseas coverage, and as the day wore on, we all made the collective decision to go and get Mother and get her home. As a result of continued calls from Mother's doctors, the British doctors finally moved her to another facility to try dialysis, since your office, Senator Bourne's office, the doctors and the American embassy at that time continued to say she should not be subject to their laws. By the wee hours of Tuesday a.m., I received more calls saying her condition was worsening, and it was not expected that the dialysis would work. By 8:30 a.m. Tuesday morning, I get a call from Blue Cross that a jet had been approved and scheduled to go directly to London from Atlanta, return to Oklahoma City where a team of kidney specialists were on call. Standard procedures for jet evacuation is for the ground crew to call and confirm the condition of the patient before departure. They called the first hospital as no one knew at that time that she had been moved, and there were no records of where she had been sent. By 4 p.m. Tuesday, the jet service confirmed they had finally found her, and the second kidney had now failed. We decided to give it 12 hours to see if any improvement would happen, and she died 8 hours later. Senator Bourne, any bill that put into law that includes any ultimate government agency control, potential budget restraints, restricts choices of plans, insurers, or providers, and refuses to reward personally responsible behavior will doom this country to mediocrity. Senator Bourne, please vote to maintain the American spirit. And ladies and gentlemen, the next day, Senator Bourne stood on the Senate floor and said, we need to trash this and start over. Because at that time, he had already resigned the Senate to become the president of the University of Oklahoma. So I urge you to make your voices heard. Thank you.
Thank you.